It is difficult to help any sick child, and even more difficult when they're inhaling a mist that is used to clear their lungs and their airways. When my 3-year-old daughter was diagnosed with asthma, I was far too familiar with what she was going through because I, as a child, too, had asthma. I had endured the same breathing treatments and inhalers that she was doing at this time. Asthma is an inflammation of the lungs in which the airways are reversibly handled. There are two types of asthma: a steady state of asthma, which gives you a tight feeling in your chest, a nighttime cough, and shortness of breath, and acute asthma, which has the same symptoms, although also includes wheezing. There are only two treatments for asthma: a quick medication, which includes an inhaler, and a long-term medication, which includes a nebulizer machine, which is what we'll demonstrate today. The most common for children is a nebulizer machine. I mentioned earlier that my daughter was asthmatic. She, unlike many others, are fortunate to have a nebulizer machine. The cost of the nebulizer machines can run from $40 to $400. The shapes, the sizes, and the characters of the machines vary. They are made this way so that they don't intimidate children because of the mask that is covering their face and because of the loud motorized noise that the machine makes. Our machine is called Moo because it looks like a cow. My daughter, thankfully, has become more familiar with it and is a lot less intimidated by it. In the past, the machines were not able to be carried around. In order to receive a breathing treatment, you had to go to the hospital and see a doctor. Now, the machines come in carrying cases, and because our machine is a cow, our carrying case happens to be a barn. The medication that is prescribed by most doctors to children for the nebulizer machine is called albuterol. It comes in tubes like this. They call vials. There are 5 vials to each pack and 5 packs to each box. Therefore, there are 25 medications in this one box. My daughter takes 3 treatments per day: one in the morning, one in the afternoon, and one at night before she goes to bed. The nebulizer treatment, or the albuterol for the nebulizer treatment, is poured into a nebulizer cup, this here at the bottom, and is inhaled through the mask. What I'm going to demonstrate for you now is the usage of the nebulizer machine. And because this is a demonstration, we won't be doing this on an actual person. The most important thing for the nebulizer machine is to check the expiration date. The expiration date appears at the bottom of the packet and also on each vial if you're only carrying your vials around with you. It is important to make sure that the substance in the vial is clear and that it doesn't have any discoloration. It's important to wash your hands to keep the nebulizer cup free from any germs as well as the mask. The next important thing is to gather all the equipment for the nebulizer machine, which includes the machine itself, the nebulizer cup and mask, and of course, the medication. You're going to pour the medication into the nebulizer cup, place the mask over the face, like so, and turn the machine on, where the mist will come out of the machine. The treatments typically last approximately 15 minutes, but when it's over, you can obviously hear the clearness that will be in the breathing from when they previously started. It's important to wash the equipment and make sure that it's all cleaned with warm water and allow it to air dry. In conclusion, some of you may never know what it's like to have asthma or to be surrounded by someone who does have asthma. In my case, I've had both. Knowing that someone is being affected by what is in this small vial and what is coming out of this small cup can be very frightening. But the wonderful thing about it is that it does work, and that it is effective, and that it does help. Because, like I said, my daughter has had pneumonia twice within the past year. I know for a fact that the medication undoubtedly does work. So, as I've explained to you, this is what you do when only the mist will do.
That's good.